This is my very brief lecture on anti-arrhythmic drugs. The anti-arrhythmic drugs are classified into the vaughn-williams classification of anti-arrhythmics, which divides them into 4 classes. Class 1, anti-sodium, Class 3, anti-potassium, and Class 4, anti-calcium. Basically, all Class 1 drugs change the slope of phase 0 of the action potential curve of the myocyte. And to reference what phase 0 is, please refer to my lecture 1. Since all Class 1 drugs block sodium channels, they all decrease the positive slope of phase 0. Class 1 is subdivided according to how each drug affects the ERP, or the effective refractory period of the action potential. The effective refractory period is comprised of stages 2 and 3 of the action potential, which again I discuss in lecture 1. 1A, 1B, and 1C affect the effective refractory period differently. As Class 1A increases the effective refractory period, Class 1B decreases the effective refractory period, and Class 1C has little effect on the effective refractory period. There are also differences in 1A, 1B, and 1C according to the types of tissue they are active on. 1A is active on atrial and ventricular tissue. 1B is active on ischemic and depolarized Purkinje and ventricular tissue. 1C is active on ventricular tachycardias, but it should only be used on normal tissue. Class 3 causes increased action potential and effective refractory period, and these are the potassium channel blockers. Class 4 increases the ERP. And that ends my concise lecture on antiarrhythmic drugs and the action potential curve.